There are two main categories of patients with problems with voice. One is what we call a functional dysphonia. So in effect, it's the way the patient is using the larynx, the voice box, that's causing the issue. And sometimes there are structural problems with the voice box. That means either the voice box has got a growth on it, which can be either cancerous or non-cancerous, and occasionally the nerve that goes to the voice box isn't working. So there's some real pathology in those patients that need identifying. But both of those types of patients with hoarse voices can present quite similarly, and that's where we come into it. The main causes of voice problems, as I've already touched on, can be split into two main categories. One is the main sort of issue that we look at as doctors is to rule out anything sinister. So we have to rule out cancers first of all. And we know that patients with cancers often have a persistently hoarse, harsh voice. And most of the time, 95% of the time, cancers of the voice box occurs in smokers. And the best way to rule out a cancer of the voice box is to look down with a telescope called a nase endoscope, which we pass into the nose whilst you're awake and have a look down at the voice box and see what's what. But of course, there are other benign non-cancerous causes, which can range from cysts and polyps on the vocal fold to an immobile vocal cord or other conditions which cause the vocal fold not to move properly because it's the way you use it. I think only a patient can answer that question, because it's the patient that we're concerned about who's suffering the consequences of their voice. The voice is so integral to our personality and the way we project ourselves that it's not for me as a clinician to say what's severe and not. We see patients who are professional voice users in my voice clinic. Of course, their livelihood is based around singing or speaking. So more and more we have to work on Zoom and Teams, and we have to be able to communicate over the net and can't rely on non-verbal communication so much. So I think it's very much patient-specific, subjective way of saying what's severe and not. Well, I go back to my original categorization of what voice problems are. Clearly, the most important thing is that we don't miss a cancer or even precancerous cells like dysplasia, which, if left alone, can progress to cancers. And of course, the earlier we spot early cancers and dysplasia, the earlier we can manage them and the better the outcome is. But even patients with functional problems, so the way the voice box is being used, you can get into bad habits quite quickly. And there are lots of techniques that I work with my voice therapists very closely with that can help patients get out of those bad habits. People often ask me this question, and voice is so crucial to communication, it's almost an impossible task to completely rest it. And I personally believe in not resting the voice necessarily entirely, but not abusing the voice is more important. So shouting, whispering, throat clearing, those sorts of behaviors are traumatic to the vocal folds and do the damage. But complete voice rest is not only difficult to achieve, but I think is not something that we can implement with our patients by telling them. So I think a realistic goal is the way forward.